Thank you so much for coming in for your follow up appointment. My name is Brianna. I'm a nurse practitioner and I will be seeing you today. Um, Today, in this visit, we'll be doing a history and a physical. Um, just be asking you questions about your health history and also including your mental health. Is that okay with you?
Yes.
All right. So please tell me your full name, just your first name,
My name is John Mark.
and your last name initial.
S.
Okay. And can you tell me your date of birth?
March 4th, 2000.
All right. And your primary language is in English.
Yes, it's my first. Yes, it's English.
Okay. And can you tell me where you were born?
I was born in Jamaica,
Okay. And what part of Jamaica?
Montego Bay, St. James.
Okay, nice. And you identify yourself as a male, I'm assuming.
Yes, I'm male.
Okay. And what is your race?
Black, African American.
Okay. Are you single, married, or divorced?
I'm married.
Okay. Do you have any cultural or religious beliefs you'd like to share?
I'm just Christian, rather.
Okay. Do you have any current medical conditions that you know of?
No, not that I know of.
Okay. Um, have you had any recent illness or sickness?
No, nothing too serious. Yeah.
Okay. Any current allergies? Any medications you're allergic of?
I think I'm allergic to augmentin. That's about it.
Are you mitten? Okay.
Yeah.
Um, are you on any medications now?
Not at the moment.
Okay. Do you take like any Tylenol or ibuprofen for any type of pain?
Occasionally. Not,
Occasionally. Okay, we'll get into that later in the questions. Um, are you up to date on vaccines?
yes, I have all my shots and boosters.
Okay. And that's like COVID, flu.
Yes.
Um, all right. Have you had any recent, like, any surgeries in your lifetime that you know of?
No, I haven't.
Okay. So, what brings you into this appointment?
Just a follow up I'm doing. Yeah.
Okay. Um, like a well visit?
Yeah, just a wellness check.
Okay.
Yeah.
All right. Um, can you tell me? Okay, so we're gonna move into like family history. Just seeing if you have any possibility of developing anything, any conditions later in life or so. So we're gonna start with your mom's side. Um, is your how old is your mom, and does she have any medical conditions that you know of?
So my mom is 61 years old,
Mm-hmm.
and I don't think she have anything that I know of. I think the only thing she have is hypothyroidism or
Okay.
something like that.
Yes.
Yeah.
Okay. Do you know any like history regarding your mom's your grandmother? Any like cancer or any?
Yeah, she died of breast cancer. That's about it. I don't know of her.
Okay, breast cancer.
Yeah.
Do you know any conditions regarding your mom's dad?
No,
No. Okay, no problem. What about your dad's side? Do you know anything about your dad's side?
not too much.
Okay. Um, what about, do you have any siblings?
Yes, I have siblings.
Do they have any conditions that you know of? Any?
Nothing concerning that I know
Okay.
about.
All right. Now we're going to move on to your social life and the things that you do on your free time. What is your highest education?
Just a high school diploma.
High school, okay. And you currently live in Missouri,
Yes, I do.
okay. And what do you do for a living?
Just work at a retail store. Nothing crazy. Part time in the military as well.
Okay.
Yeah.
So you're reserve, um,
Yes.
and what part is it?
This Army. Missouri
Army.
National Guard Army. Yeah.
Okay.
Regular Army.
All right. Do you live with anyone?
Yes, my wife and 2 kids.
Okay. And so, do you smoke any tobacco? Do you do any legal drugs?
No, I don't.
Okay. Do you currently drink alcohol? And if so, how many drinks a day?
Yes, I have a drink from time to time. Maybe 2 to 3 bottles a day, or 2 to 3 drinks a day, probably. Not every day, but every so often.
So, how many, like 3 times a week, you'll have a drink?
Probably, yeah, more like that.
Okay. All right. How often do you exercise?
More like 3 times a month. Should be more, but
Yeah, we all should be exercising more. Um, what does your diet look like? Are you eating, your fruits and vegetables, or are you eating out a lot?
I try to eat my fruits and vegetables.
Okay.
Yep.
And so these questions would be pertaining to your sex life. Are you sexually active?
Yes, I am.
Okay. Any history of sexually transmitted diseases that you know of?
No.
Okay. Anything else you'd like to add regarding your social life? Or you think we answered most of the questions?
I don't have anything else to add at the moment.
Okay. So now we are going to move on to a head to toe assessment, just asking you questions regarding each body system. So generally speaking, have you noticed any increased weakness, fatigue, or any fevers?
No.
No, all right. So pertaining to your head, do you wear any glasses? Have you had any eye pain, head pain, like headaches, ear pain?
No, I don't.
Okay. Any swelling in your neck or eyes or ears?
No.
Okay. Any drainage in those areas?
No.
Okay. So we're going to move on to the pulmonary region, and this is like your lungs, your lung region. Do you have any issues or conditions that you know of, like asthma?
No.
Okay. Um, have you had any like shortness of breath or cough?
No.
Okay. So we're going to move on to cardiovascular system. That is your heart. Um, have you noticed any chest pain, chest tightness, or palpitations?
No, I haven't.
And have you noticed any swelling in your hands or your feet?
No.
Those could be signs of like congestive heart failure. All right. Um, let's see. So, do you monitor your heart rate, like iWatch or anything?
I tried to on my Apple Watch sometimes.
Okay. And do you know like normal range is between 60 to 100? Is it ever?
It's between there most times.
Okay. Okay, so that's good. Um, let's see. So we're gonna move on to the GI tract, and this is like your gastrointestinal. Have you noticed any, or have you had any nausea, or vomiting, or diarrhea?
No, nothing like that.
Okay. Constipation.
No.
How often do you have bowel movements? Like once a day
I have
or
bowel movements maybe every 2 to 3 days.
every 2 to 3 days?
Yeah, or every 2 days rather.
Okay, every 2 days. Okay.
Nothing out of the ordinary.
All right. How's your appetite?
It's good. I eat on time and
Do you eat
well
3 meals a
balanced.
day?
Yes, I try to lean towards eating 3 meals. Not every day. Most days it's probably lunch and dinner. I
Mm-hmm.
might skip breakfast sometimes to go to work, but I try to eat 2 healthy meals.
Okay, so typically we want you to eat breakfast. That's the main course of the day because you're starting, you're waking up. Your body needs some nutrition, but you can either drink a protein shake or something. Something easy. Just um, a few facts for you. Let's see. Any heartburn after you eat?
I don't know.
What about abdominal pain?
I don't know.
Okay. Any history of appendicitis or gallstones?
No.
Okay. And then we're going to move on to the urinary system. Do you have any issues with urinating, like any pain? Um,
No.
no issues. Um, any swelling in your peri area you noticed?
I don't know.
Okay. And what is typically the color of your urine? Is it clear, yellow?
It's usually clear.
Okay. Have you noticed any blood in your urine?
I don't know.
All right. Any history of UTIs?
No.
Okay. What about kidney stones?
No.
Okay. Any other urinary issues that you think I should know of?
No.
All right. Moving on to your skin. Do you have any skin issues?
No.
All right. Any like moles on your body?
No.
All right. Okay. Now we're going to move on to musculoskeleton. Oh, hold on. Going back to your skin. Oh, we'll move on. Okay. Musculoskeleton. Do you have any issues with pain in your arms, your legs, your back?
No, I don't.
No issues in your back?
No.
Okay. Now you told me earlier that sometimes you do take either ibuprofen or Tylenol. Is that regarding like sometimes you're getting pain or?
It's just occasionally when I get some pain from work, maybe being a little overworked. Yeah, that's the only time, but I try not to just take it for no reason.
Okay. So the onset is from after work. You're stating. Um, and where does the pain normally? Um, the location of the pain.
It's either my lower back sometimes.
Okay, lower back.
Yeah, majority of the times.
Okay. And do you know how like often it lasts, like the pain lasts?
Maybe a day or two, then it subsides.
Okay. And then, what would you describe it like? A sharp, dual, throbbing pain?
It's not too crazy. Maybe a little dull. It's
Just
not.
aching?
Yeah.
Okay. And aggravating factors. So at work is mainly from you lifting or
Yeah.
so? Okay. And relieving factors, you're stating that pain medication help like Tylenol, ibuprofen. Okay. And you take that like every 6 hours as needed.
Sometimes I just take the first dosage and it kind of
And
knocks it out.
okay. And let's see. And we talk about it was intermittent pain. And from scale of 1 to 10, what would you rate that pain normally that you experience?
But maybe a 5.
A 5. Okay, perfect. So we're going to move on. Well, have you had ever broken any bones that you know of in your lifetime?
No.
Okay. So moving on to neurology. Any conditions regarding like concussions or head injuries?
No.
Okay. Have you noticed any numbness or tingling in your toes or hands? Any blur vision?
No.
All right, perfect. And now we'll be moving on to blood disorders. Um, any history of blood disorders such as sickle cell anemia or any other blood disorders?
No.
Okay. When you get a cut, does the bleeding normally subsides? Or do you typically bleed a lot? That's what I'm asking.
It'll subside.
Okay. And do you know your blood type by chance?
I think I'm O positive.
Okay. And have you ever needed like a blood transfusion?
No, I haven't.
Okay. All right. Do you feel safe at home?
Yes, I do.
Okay. And do you have any support system?
I have some good friends who I talk to occasionally about stuff.
Okay.
Yeah.
Do you feel happy? Any like symptoms of anxiety or depression?
No.
No. Okay. Um, and any trouble with sleeping?
No.
Okay.
I gotta fall asleep.
Do you know how many hours of sleep that you normally get?
I try to get between 6 and 7 hours at least.
Okay. Yeah, so typically we say 8 hours, but yeah, you're getting roughly 7 to 8 is good. How do you feel about your health?
I feel like it's good. It's okay.
Okay. Well, that finishes my questions. Do you have any questions for me?
Not today.
Okay. And no issues with your health wise. You're doing pretty good.
Uh, do you think 2 to 3 drinks a week is a lot?
2 to 3 drinks? No. So males normally they say up to 2 drinks a day. It's fine. Typically, when you're drinking like a whole pint or so, or going over the 2 to 3 drinks a day, that's a lot. But you're doing pretty good.
Okay, I just didn't wanted to know if I was an alcoholic for having that, but that's it. I don't have anything else.
Okay.
Yep.
And do you feel that you're alcoholic, or
No, I was just
you were just
trying to hear from
okay?
professionals like you. So
All right. Well, if you have any other questions or any concerns, you can always call my office, and you could talk to me as well. But it was very nice to meet you, John Mark.
all right,
All
Brianna.
right. Thank you.